Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck,
I
physical
want him to wake
therapist.
up. And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're going to talk about
Discectomy.
discectomy.
So discectomy is a surgery procedure that if you got a back problem and you're having pain down the leg, you go to the doctor and the surgeon, they may say you need a discectomy. And what is it? Sounds like a big word. It's going to scare you.
Right.
It's cutting into your back. They're going to get in by your spinal cord. Could be scary. They're very good at it though. And what you'll find out, I'm not going to talk about the symptoms too much, but actually about the procedure. If you look at what do we call
Napoleon Bonaparte.
Yeah, this is our model skeleton here. And we're going to look at lumbar vertebra 4 and lumbar vertebra 5 because that's the area these are going to happen. Probably
Right.
4 and 5 or 5 and S1.
S1, yeah.
But we're looking at these two, and we have the disc is up in the front here. You can't see it on this angle. Yeah, we can just simply turn, and there you can see a good healthy disc right there. Let's go back to here. Okay, and if you're having back pain and it is a bulging disc and they need a discectomy,
Or herniated disc.
or herniated disc, exactly. I'm going to imagine this, we take these two vertebrae and we pull it out and we're going to move bone apart over there, and here are the discs. Okay, Lonnie, you're going to get a nice close-up here.
You're the vertebrae.
As a matter of fact, could you hold on to that,
Sure.
Bob? I'm over 50 now, so I have to have my power specs on here. 2.0, by the way.
Here we go. I'm glad to
Okay,
do that.
so here we go. We're going to take off L4 so we can look in here. Now this is your spinal cord, and here's your peripheral nerves going out here, and those, by the way, go down into your legs. That's why referred pain oftentimes goes down the leg. Now if you look at this disc, there it is. Now if you look at this disc, it has a problem. Can you hold on to that, Bob?
Actually, if you show it like this, Brad.
Oh, sure. There, that's a good idea, Bob. You are outstanding.
Because that disc had herniated and it was actually pushing on some of the spinal nerves as they come off the spinal cord there.
This should
So-
look like this side.
Right.
Now, a disc, if you actually look at it, is not like this. It's not like a piece of rubber. It's not solid. A disc actually is kind of like a jelly donut. Around the outside, it has tough fiber annulus tissue, but in the middle, there's actually a gel-like fluid, and that makes it pliable, and it makes you allow you to bend and twist. It
Sure.
actually acts like a little bit of a shock absorber. Now, a discectomy, disc is the disc, ectomy means removal.
Right.
Now, I always wonder, do they actually remove the whole disc and take that disc out of there? They could, I mean, that's possible, but a lot of times they may just remove the herniation or the bulge. I don't
Snip it
know,
off.
Bob doesn't know. You have to talk to your surgeon. They'll let you know what they're going to do or what
Right.
they're going to try to do once they get in there. Now, the really cool thing about this, Bob, is look at Bonaparte back. And I know you've seen this, and any therapist has seen this that worked on someone that had a discectomy in the last few years or even longer. You would think to get in there to do the procedure, they'd have to cut a incision about 3 or 4 inches
Right.
wide. They're about 1, maybe 2 inches at the most, probably
Sure.
1.5 inches. Little incision, usually an in and out procedure. You just go there and you leave the same day. You might stay one night. And oftentimes they don't need therapy.
The scar is not the problem, and you're right. We often don't see these people.
Right.
They don't come in for therapy.
And
They're fine without it.
and if it's successful, oftentimes I've talked to people, they say, when I left, my leg pain was gone.
Yep.
They get the bulge out, it's not pushing on the nerve anymore, and it can be very successful. On the other hand, there are a small percentage that
It doesn't work.
and they have to come and see therapy, and then we work with them to
Right.
resolve it.
And in those cases, sometimes that might not have been the entire problem.
Right,
It might be something else
exactly.
going
You
on.
bet, might be
So-
something called a misdiagnosis.
Right.
So anyways, we should applaud Bonaparte here, and he's gonna applaud himself. There we
Yeah.
go, for a good job on discectomies.
And make sure you subscribe if you haven't already.
Right, thank you very much, he says.
Yeah.